Hello, and welcome to my Prezi on the Belizean Alternative Medicine and Therapies presentation. I'm your presenter, Natalie Tesh. First, I have a map detailing Belize's location. Belize is part of the Maya in Central America, and their alternative medicine has been studied for quite some time. Most of the common remedies we use in conjunction with Western medicine are widely recognized, but as this is difficult to regulate, most providers don't explicitly prescribe these treatments. However, these options are not discouraged either. The Belizean culture sees health as being in balance with the laws of nature, and disease causes an imbalance that needs to be treated with its counterpart, which we'll discuss countering this imbalance in a later slide. Most remedies are plant based, but there are some interesting therapeutic options as well, and we will also cover their extensive knowledge of surgery back in ancient times more so. So here are some common plants that are widely recognized. Serosi, depending on how this plant is prepared. The tea can be ingested for painful or delayed menses or bathed in as a tick and lice treatment. So very different but versatile. Next we have this second plant, known for its yellow flowers and bitter tasting leaves. It's used as an anti-parasitic agent, and we'll go over why the color of the flower is important as well. Next, we have China root, and it has antispasmodic and anti-inflammatory properties for many conditions, ranging from muscular spasms to arthritis. Now we have the Sina alata, which I have pictured here, useful for urinary tract conditions and kidney and liver health. Contribo is memorable for its smell, which is described as rotting meat, and is ironically fertilized by a fly. However, it's commonly used to treat colds, flu, stomach aches, and indigestion. Additionally, it makes for a good beverage when soaked in rum. So remedies are chosen based on the flower's color and how well that color reflects the physical ailment. So a red plant would be used for rashes, blood disorders, and burns, because those are also kind of represented by the color red. And blues are seen as a natural sedative, so blues are kind of depicted as the central nervous system. And yellow is the color of bile and therefore helps with the liver and the spleen. White is actually avoided because this is a sign of death, as seen in a dead person when they lose all their color. So this plant mentioned here, Sina alata, it's yellow, and yellow is represented as gut health as well as, liver and kidney function that is said to help. That said this plant is to help. So the purpose matches its color. Next, let's discuss treating an illness with its counterpart. So conditions such as constipation, cramps, and paralysis are deemed cold illnesses that must be put back in balance to achieve optimal health. And so these are treated with hot treatments, such as eating spicy foods, and in turn, hot conditions such as fever, nausea, vomiting, and diarrhea, those are treated with sweat baths. And although this seems like a hot treatment, it's actually considered cold because it drains the body of heat, therefore attempting to make the body cold and balanced again. So it's kind of like an olden day sauna, which is still used to sweat out those same sicknesses today. Here's just an extra slide on some interesting surgical treatments. They found a way to suture wounds with human hair, and I was not able to find specifics, but it made for accurate and precise cuts that healed quickly. They also had a type of drill that performed impressive trephined skull procedures, and these procedures put holes in the skull. It's uncertain why they did this. But lastly, they were also astounding dentists who created decorative teeth made from organic materials such as jade or turquoise, and it was popular with women, so instead of piercing your ears, I guess you got your teeth pierced instead. The chronic condition I will discuss with such therapies is hypertension. Common plants I researched included garlic, moringa, tea, and breadfruit. Studies performed examined the duration that patients used Belizean plants as well as preparation of these plants. Interestingly, different parts of the plants were used. And so, for instance, let's use this garlic moringa plant. Some may have eaten the seeds to treat hypertension, Others may have used the leaves and or flowers and they would have eat them, or they could prepare them as a tea. Any part of the plant that was used played a potential role in managing patients' confirmed hypertension diagnosis. And most studies have been done using Belizean plants alone and when used in combination with Western medications for hypertension. The overall results found that these plants have been shown to treat and maintain adequate blood pressure for those with hypertension. Now, my professional nursing opinion is that this alternative therapy has a wide use that can be used how the patient sees fit. Kind of like I was saying earlier, there's a lot of conducted research that ensures my confidence in this treatment. If someone wants to eat breadfruit or drink the leaves as tea, the patients choose how they want. Most of these plants don't interfere with Western medications, so this is another finding that makes it more appealing as a healthcare professional. But as a nurse, however, it is my job to research and ensure the safety of my patients. And some studies have found that concurrent use with Belizean plants and specific drugs such as hydrochlorothiazide may produce slight side effects. So, not every plant is going to be safe with every type of blood pressure medication, and so that's an important consideration. Here's a qualitative study discussing how patients felt using Belizean remedies. Participants felt confident and good about their hypertension management, and this was confirmed with physician visits and recorded blood pressure. And for the most part, it would be whether they were using the plant alone or the plant with Western medication, they all reported an equal mutual feeling of wellness. Here is a quantitative study that used questionnaires from a wide range of different populations with hypertension, including gender, age, marital status, education, and income. Most respondents knew of this alternative treatment of Belizean remedies as well as Western medicine in the treatment of hypertension. Still, most respondents did not use them concurrently for fear of adverse effects. Again, as a nurse, I would intervene if there was a notable reason to discourage Belizean medication as a treatment. Additionally, if there was not enough research conducted, I would tell my patient it's not best to use such a treatment as it's not well known enough. Lastly, here is some pricing information on the cost effectiveness of these treatments. Plants can be grown at home or in community gardens. Most people reported having to pay maybe a maximum of $6 to $8, so that's, of course, an upside of Belizean therapy and something to consider as a nurse when intervening for patient safety and convenience. And here are my references. Thank you for watching my Prezi.